right, so I wanted to talk to you guys a little bit about what happens with filler sometimes when there's a complication. And I know each of you have had some kind of unique stories lately, and I wanted you to kind of explain that.
Yeah, I mean, I think the first thing is understanding what complications can happen with filler. We talk about it with all of our patients, and we're assuming that everybody talks about it with their patients. But obviously, you can get an infection because there's a needle, but we clean really well for that. You can get bruising because there's a needle, but that we try to be careful with that. And the worst of the complications is if filler gets injected into an artery. That's called a VO, a vascular occlusion, and so there's no blood flow to that area, and you can lose tissue if that happens. You can also, if there's just too much filler, you can compress the vessel, the artery, and that's a vascular compression with kind of the same results. So those are what can go wrong. So then how do we address if it does go wrong?
So I mean, those are things that can go wrong. I'd say the other things is where filler is being placed, right? So it's not that you can have a complication from just filler being in the wrong place. Maybe it's not on a bone or closer to a bone, it's in a muscle, or there's just too much filler for the volume.
Yep.
And it's just expanding the space too much. So it's causing a little bit of discomfort, but it's not technically an emergency. These are all still akin to bad aesthetic outcomes, poor patient experiences. But yeah, no, if you do have a filler complication, the whole point of Hylenex, and that's why it exists, it is generally a hyaluronic acid reversal. And so every practice that's injecting any kind of HA filler should have the reversal on hand for any kind of immediate use.
This will dissolve the HA filler that goes in. So anywhere you go, if it's not here, anywhere you go, you ask if they're going to do filler. If you're going to inject an HA filler, can you dissolve it? If you can't dissolve it, if they can't dissolve it, you need to leave, go somewhere else.
Right. You should be prepared for a complication if you're going to do it.
And some of the complications that we've seen, these were not our own personal complications, they're ones that came to us from elsewhere. I had a very nice lady who lives in another city who had injections done in another state and reached out to us because she had a complication with some jawline filler, and instead of it being placed on the mandible itself, on the bone, it actually was in her masseter, the muscle, and so she had horrible pain, horrible swelling. She couldn't open her jaw for a month, and she finally came to us and we started using Hylenex to dissolve it.
Yeah, the complication that I just saw recently also is not a patient of ours. It was another practice that came to us because she just had too much filler put in her lips. So she had 2.5 syringes of filler put in about a 3 to 4 week span, and that is just way too much volume for the space of a lip in that short of a time. So she didn't necessarily have like a vascular occlusion complication for a lack or a stop of blood flow, but it was way too much space, and so she was very expanded, and which led to uncomfortable. So we actually saw her in the emergency department as well because she just didn't know where else to go. And that's part of the reason we're talking about this, right? And so the hospitals generally aren't going to handle your aesthetic complications.
They don't have Hylenex in the hospital.
So you just need to make sure that wherever you're going, they're going to be able to handle a complication that you have.
Yep.
And the lip filler case was a little unique too, and how the filler was put in.
True story, yeah. So this particular person went to a place that doesn't inject filler in the traditional sense through a syringe the way we generally do it here. It was put into a skin pen, and in those are kind of unique. They're cartridges that you can actually customize. So you can put a little toxin there, you can put a little filler in there, and you can almost start micro-needling through places on your face. This treatment was designed for her to get it micro-needled into her and around her lips. So she ended up with extremely large lips, way too much volume, and a poor aesthetic outcome.